My grandma's I'm Dr. Mohammed MSCOO7 version. Welcome to medical science class. As a student of medical science, I wanted to take paper every branch of medical science. সকলকে সুস্থ আল্লাহ শিবাদত আল্লাহ শাকিল আল্লাহ শাকিল আল্লাহ জিল্লাহ শাকিল আল্লাহ ইয়া আলিফ লাম লাম ইয়া আল্লাহ শাকিল লাম আল্লাহ ইয়া কুদ্দুস ইয়া আল্লাহ ইয়া ওয়াদুদ ইয়া আল্লাহ কুদ্দুস আল্লাহ. Now my friend and supporter, we discuss about central nervous system. In central nervous system, there is a brain, spinal cord, then cervical plexus, brachial plexus, lumbar separatus. Different 12 pair central nervous system, brain, spinal cord. Then 12 pair cranial nerve. What about vagus nerve? Okay, we discuss about vagus nerve. You know that 12 pair cranial nerve, 31 pair spinal nerve, 4 plexus cervical plexus, lumbar cervical plexus, brachial plexus, lumbar sacral plexus. Now peripheral nervous system, 12 pair cranial nerve, 31 pair spinal nerve. And in case of efferent nerve fiber, response to motor in efferent nerve fiber. Efferent response to sensory, sense carry to brain. Efferent response to motor, sense from peripheral nervous system to central nervous system carry sense. Efferent exit response to motor. For example, here anything happen. For example, hit. I give hit and hit is more, remove the hand. In case of sensory, carry the sense to central, peripheral to central, and motor, then motor response, avoid the head, avoid the hand. Efferent fiber, nerve fiber response for motor, efferent nerve fiber response for sensory. Now my friend was about nervous system. In nervous system, you know that if what is dermatome, just of skin nervous system, which muscle area cover that nerve fiber? You see that the muscle area. If muscle area cover that same is originally the same nerve fiber. By that process you know that the dermatome. In case of bicep, in case of tricep, in case of forearms, in case of pectoral major, minor, abdomen, ab muscle, thigh, leg. You found the which area? In case of every dermatome, supply the original same nerve fiber. Now that is the tricks. Then you say exception. You see that. Now my friend must about central nervous system, peripheral nervous system. Peripheral nervous system, you know that heart, lung, abdomen, sympathetic supply, parasympathetic supply. Parasympathetic supply, vagus nerve. In case of heart, sympathetic supply, spinal nerve. T3 to 5. See that? Open the book. Sympathetic nervous system. And in case of abdomen, organ nervous, sympathetic supply by spinal nerve. In case of peripheral nervous system, 31 pair spinal nerve. How form 31 pair spinal cord? Formed by anterior ramus, posterior ramus, or anterior rami, posterior rami, form a spinal nerve. Posterior MI nerve supply the back muscle. Anterior MI nerve supply the front side of the front side. Anterior posterior MI give the nerve supply of the back side of the body, and anterior MI front side of the body. Spinal nerve formed together from spinal cord, MI, and form by bind together anterior and posterior MI. And form spinal nerve. You see the formation of spinal nerve. 31 pinal spinal nerve. And spinal nerve, in case of spinal nerve, you know that thoracic, cervical region, thoracic region, lumbar and sacral region. Fine. And what is the skeleton? What is the skeleton? First, thoracic region, standing head, fine. Concave, convex, then lumbar region, thoracic region, cervical region, convex, thoracic region, concave, lumbar region, convex, sacral region, concave. That is the skeleton. See the skeleton. Now you see that the skeleton, cervical region convex, thoracic region concave, lumbar region convex, sacral region convex. See that sacral bone concave. Fine. Now my friends, about our spinal nerve. If any cut the spine, anyone cut the spinal nerve, what happens? How you correct that? Nearest in case of repairing the nerve, not suturing the nerve, repairing the nerve into in, repairing the nerve, then vitamin B1, B6, B12 given. Correct. In case of nerve repairing, surgeon fear about nerve. Vein artery can suture, nerve cannot suture. But you can into nerve repair that. And give vitamin B1, B6, B12. Also for nerve repairing, you can protein, essential, non-essential amino acid. Essential amino acid. Now my friend and supporter, central nervous system is brain spinal cord. Peripheral nervous system, 12 pair cranial nerve, 31 pair spinal nerve. In case of cranial nerve, vagus nerve. Vagus nerves have two forms. How much vagus nerve? And vagus nerve, especially vagus nerve courses, maybe some exception. Exception is not example in case of cranial nerve. In cranial nerve, olfactory bulb, smell, optic, eye. In eye means olfactory, optic, oculomotor, cochlear, SO4, oculomotor, SO4, LR6, superior oblique, SO4, superior oblique, olfactory, optic, oculomotor, cochlear. Cochlear nerve देख दे superior oblique muscle होता है. Olfactory, oculomotor, cochlear, trigeminal abduction, LR6, lateral rector, trigeminal abduction. Rest of them olfactory, optic, oculomotor, cochlear, trigeminal abduction supply the eye muscle. Olfactory is smell, optic eye, then oculomotor, cochlear, trigeminal abducens, eye and eye muscle. Olfactory, optic, oculomotor, cochlear, trigeminal abducens, facial supply, and facial pulse. What is the treatment of facial palsy? If facial palsy, repair the nerve, facial muscles. Then exercise. First exercise, but exercise not correct properly. If we then can correct exercise. If not correct, then nerve repair, facial nerve repair. Olfactory, optic, oculomotor, cochlear, trigeminal, abduction, facial, vestibulocochlear, supply the ear. Glossopharyngeus, tongue. Vagus, heart lung parasympathetic system, abdomen. You know that heart lung, abdomen organ, parasympathetic system supplied by vagus. Olfactory of vagus. Accessory, hypoglossal, accessory nerve. Hypoglossal supply the glossal. Accessory nerve supply the accessory nerve. Shoulder, you know that neck region and shoulder. Fine. Neck region and shoulder. See that both. And hypoglossal below the trunk. Okay, fine. And in case of two-thirds of the anterior tongue anterior two-thirds or posterior two-thirds, anterior one-third or posterior two-thirds. Also that there is a contribution of facial nerve. In case of tongue, glossopharyngeus also facial nerve. Now that is the 12th pair of cranial nerve. Now spinal nerve formation of spinal nerve, that is your homework. How form, why you say spinal nerve, and central nervous system, peripheral nervous system. Central nervous system include brain, spinal cord, peripheral nervous 12 pair cranial nerve, 31 pair spinal nerve. And in case of plexus, cervical plexus, brachial plexus, cervical plexus, brachial plexus, lumbar sacral plexus. Then you know that the nervous system, and life is a special type of sense. Life is a special type of energy content sense. Where life is present in nervous. As per I know, Allah knows best, not only best, but in nervous system. Life equal more or less picometer. Picotechnology. As per I know, Allah knows best, not only best, but also everything. Now my friends and supporter in medical science class, today is enough from medical science class. Next class we elaborated about what is the document evidence of life remain nervous system. In case of heart transplantation, the document evidence is if your heart transplant possible. But in case of brain transplant, quite impossible. That is the reason, as per I know, the life present in nervous system. If heart transplant is possible, not cardiovascular system. And in case of lung transplant possible, not respiratory system. And in case of musculoskeletal system, you know that if hand fracture or leg fracture, patient can survive. Now, cardiovascular system, cardiovascular system, musculoskeletal, lymphatic system did not cut down, patient survive. But if nervous system, brain transplant is so tough, it is not possible. That is the reason, that is the proof.